The biggest myth about morning sickness is the fact that it is not just in the morning that you feel sick. The correct term is actually nausea and vomiting in pregnancy, and it can occur any time of the day or night. And up to 80% of women will actually experience nausea and vomiting to some extent in their pregnancies. It's really only a lucky 20% that don't. And thanks to Kate Middleton, you might already know that there's a severe form of nausea and vomiting in pregnancy, which is called hyperemesis gravidarum, and it only affects about 1% of women in pregnancy. That is severe enough that it requires hospitalization. So what is nausea and vomiting in pregnancy? So generally, the majority of women who experience nausea and vomiting will experience a light to moderate nausea in pregnancy up till about 12 to 16 weeks. So that's the one side. You only feel nauseous, but you don't actually vomit. Then you go up one level. Maybe once or twice you had an episode of vomiting. If you go a little bit higher, you get chronic nausea and frequent vomiting. So it can be daily, it can be a couple of times a week, but you are chronically nauseous and every now and then it goes into vomiting, and then eventually you get to the point where it's so bad that you cannot retain any fluids and you have to be hospitalized to prevent dehydration, because severe dehydration can lead to things such as miscarriage. So I was one of the very lucky ones in my twin pregnancy where I had chronic nausea and I vomited daily. And I got so much advice from other people about how to manage nausea and vomiting, and there's a point where certain things help, and then there's a point where nothing helps except medication, and sometimes that doesn't even help. But in my case, nothing helps. So the typical advice that you would hear is eat something dry, eat a cracker. When you wake up in the morning, before you get out of bed, eat something, because the nausea gets worse when you feel hungry. That is true. You do get more nauseous as you feel hungry. But in severe cases, eating also makes you nauseous. So there's not really much you can do about it. So you can eat something dry, like a dry toast or a dry cracker. Eat regularly, like every 1 to 2 hours, and then make sure that you eat small meals, because you still want to make sure that you get enough in, and you drink water, but just space it out. And then something else to add on top of that would be to not mix food and water, like liquids and solids, because it can make your stomach feel fuller, which makes you more nauseous. So eat something, give it 30 to 40 minutes, and then you drink some water, and then you wait another hour or so before you eat again, just to space it out a little bit. So there are a couple of things that you can try, and if any of these work for you, then you are lucky and you can carry on with your daily life as normal. But for many people, nausea and vomiting becomes so bad that it affects their quality of life. And you don't even have to be admitted to hospital for it to affect your quality of life. And I was pretty much in that space. I was miserable. I did not enjoy my pregnancy because I was just nauseous all the time for 7 months. My babies were born prematurely, so I was nauseous throughout, and I vomited every single day. So I worked quite far from home, and I literally had a vomit bucket next to me in the car. And it sounds disgusting, I know, but if you are one of those who are also chronically nauseous and vomiting every day, you might understand, or maybe it might even help you. But I had a bucket in the car, so if the nausea got overwhelming while I was driving, I vomited in the bucket, in the car, on the road, because it wasn't always possible to just pull over and open the door. It's obviously not ideal to vomit while you drive because you can't see in that moment, but it was my backup. If I went to the shops, I took a little plastic bag in my handbag, because if that gag reflex just started, which is very normal in pregnancy because your gag reflex is way more sensitive, it's also linked to the fact that you have an increased sense of smell during pregnancy. Even in my house, I walked around with a bucket in my arms the entire time, because if I'm too far away from the toilet, there's no way that you can stop the vomiting. If it's coming, it's coming. So if that's you, you absolutely have all my sympathy. If it's not you, you're very lucky. Take that as a win. So how is it treated? So besides the non-medicated things that I've mentioned before and that you might hear from friends, there are certain steps that they can follow. So your doctor might start with something like antacids, because bloating or reflux can actually increase your nausea and your tendency to vomit. So an antacid might work. For some, it just makes them feel worse. Your multivitamins might actually also make you nauseous and vomit more. So if it's really bad, you can, in your first trimester, only take folic acid. If you have multivitamins that don't contain iron, you can take those as well. Iron in multivitamins tend to make you more nauseous. So once it's passed and you're feeling better, you can add back your multivitamins. The other option that worked for me as well was to take my multivitamins at night. So if it does make you more nauseous, you are not up and down at work. You can, if you need to vomit, vomit. But I found when I was lying down, that was the only time that I felt the least nauseous out of all. So it worked for me to take it at night. After antacids, if that doesn't work, your doctor might try something like pyridoxine, which is vitamin B6, to see if that might help with the nausea and the vomiting. So they slowly try and add things to see at what level are you comfortable. If that doesn't work, they try antihistamines. You might find it odd, but antihistamines help with nausea and vomiting in pregnancy, but some of them can make you feel very sleepy. And this brings us to a medication called ondansetron. It might sound familiar, you can look it up or you can find some links below in the description if you want to read more about it. This medication is anti-nausea medication that's typically used for patients on chemotherapy, so it's really strong. And the concern was that ondansetron was harmful to the baby. But there is a large amount of research that focused on the use of ondansetron in pregnancy. Any type of medication in pregnancy or breastfeeding can only be tested if people are willing to take it. So research with medications can be really tricky because you cannot force anybody to take a medication to test the effect versus people in a control group not taking it. You have to see those people who are willing to take it, what happens to them. So it becomes very difficult. But most studies that have been done on this have not found any adverse outcomes. There's a specific systematic review that you will find in the description below that looked at all the aspects that was considered adverse outcomes for the baby. Neural tube defects, cleft palates, heart defects, spinal defects, all of these things. And this systematic review has concluded that there is no sufficient evidence to show that using ondansetron in pregnancy has adverse effects on the baby. And you might sit there and think, but why would anybody even risk this in the first place? Nausea and vomiting in pregnancy can be debilitating for people. There are actually studies that showed that nausea and vomiting was given as a reason to terminate a pregnancy when it became so debilitating for women that they couldn't function normally in their lives, among other reasons. And I know it sounds terrible, but it's the reality. It is debilitating for some people. And that is why there's so much research, because ondansetron seems to really help people. As I said before, it's a strong drug. And many doctors do prescribe it, not because they're reckless, but because no research has found adverse outcomes. They've been testing it and it is still ongoing. They will always continue with research. But no adverse outcomes have been found, but it is considered safe to only use it after 10 weeks of pregnancy, because the biggest concern was that ondansetron affects the fetal development. So I hope that helps. At the end of the day, all I can say is everybody's experience of nausea and vomiting is different. Don't belittle others if they manage to feel better while eating a biscuit. And at the same breath, don't think those who are using medication or are being admitted are just perhaps weak and they cannot handle it. It's very debilitating. It affects your functioning. And for me personally, it affected any future pregnancies that I might have wanted, because I cannot see myself going through that again. I feel like I have PTSD from vomiting on a daily basis for months at a time. And once or twice it got to a point that it went into a spasm and I couldn't stop vomiting and I couldn't breathe. Nothing was coming out anymore. I just had such a spasm that my vocal cords also spasmed and closed and I couldn't breathe and I nearly blacked out. So if I'm saying it's debilitating, that was one experience for me. Your experience or someone else's experience might be much worse, very different, but just understand that people don't pretend that they're not feeling well. It can be horrible. I really hope this helps. Go read up more if you're not really sure, and just know that you are not alone.